Okay. The committee will please come to order. A quorum is present. The committee meets today in pursuant to notice, and without objection, the chair may recess the committee at any point. At a time when Americans are facing rising healthcare costs, declining public trusts, and worsening rates of chronic disease, strong leadership at HHS is more important than ever. Under Secretary Kennedy, HHS is taking bold and decisive action to make America healthy again. Healthcare is a critical part of the equation. Yet for too many families, the cost of care continues to rise while transparency remains out of reach. Patients and employers are too often left in the dark, unable to make informed choices about price and quality. That's unacceptable. Americans deserve clear and upfront pricing that will help drive competition and lower costs. This committee remains focused on strengthening transparency and ensuring the system works for patients, not against them. And we're glad to have the partnership of this HHS to help accomplish those goals. But access to health care is only one piece of the puzzle. Health begins long before a patient enters a doctor's office. It starts with nutrition, prevention, and daily choices. Under Secretary Kennedy's leadership, HHS has righted the food pyramid and delivered scientifically sound dietary guidelines for Americans. These are critical steps toward building a stronger foundation for public health, particularly for children. This is also an era where the committee has led. We restored access to healthy, full-fat dairy in federal child nutrition programs, ensuring children receive the minimum they need to grow and thrive. Health is also shaped by environments in which we live, strengthening high-quality early childhood education and care programs that working parents rely on, and protecting them from waste, fraud, and abuse helps create a culture of learning and care where our children can thrive. At the same time, restoring focus and accountability in these programs is critical to earning the public's trust. Taxpayer dollars should support children and families, not advance ideological initiatives. This is particularly true of DEI-driven mandates and gender ideology that have saturated our society. Policies that promote or subsidize irreversible medical interventions on minors raise serious concerns, both medically and ethically. Sex-rejecting procedures and mutilating chemical treatments are an abominable use of federal taxpayer dollars and tear at the very fabric of American society. I'm very glad to see HHS taking steps to combat this and ensure that the well-being of children, not politics, remains the focus. Finally, I want to commend the department for also making America fiscally healthy again. The department's budget proposal reins in a bloated, unaccountable bureaucracy by restructuring HHS to refocus on core principles, all while saving taxpayers $1.8 billion every year. In other words, HHS is doing more with less. That's exactly the kind of governance the American people expect and deserve. At the end of the day, this is about people. Families trying to afford care, parents trying to raise healthy children, and communities striving for a better future. The policies we shape here have real consequences in each of their lives. We have a responsibility to get this right, and I certainly appreciate Secretary Kennedy's willingness to take on these challenges. And I look forward to working together to build a healthier, stronger future for every American. With that said, I yield to the ranking member, the gentleman from Virginia, Mr. Scott, for his opening statement.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for your testimony this morning. Your appearance before the committee today, as they say, has been a long time coming. Mr. Secretary, you lead an agency that has immense responsibility to both enhance and protect America's well-being. The mission of the Department of Health and Human Services is to embrace the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. This mission is why many get involved in public service in the first place. This is in part why the President's words the other day were so shocking. As President Trump said, and you can see over my shoulder, we're fighting wars. It's not possible for us to take care of daycare, Medicaid, Medicare, all these individual things. They can do it on a state basis. You can't do it on a federal level. You have to take care of one thing, military protection. And regrettably, the proposed budget that you're here to defend today reflects that sentiment. Overall, the White House's proposed budget reduces HHS discretionary budget authority by about $15.8 billion, or 12.5%. If these proposed cuts are enacted, it will have devastating consequences for Americans' health and well-being and will raise costs for America's families. Take Americans' health care, for example. The proposed budget cuts target public health agencies such as the Center for Disease Control and Prevention and the National Institutes for Health, weakening the systems that communities rely on to prevent disease and respond to crisis. Additionally, thanks to the cuts from H.R. 1, or what we refer to as the Big Ugly Bill, policies of this administration, Americans are now paying more to see a doctor and to fill prescriptions. Americans should not have to go into debt just in order to stay healthy. The department should be focusing on ensuring affordable, accessible health coverage for as many people as possible. Regrettably, when fully implemented, the actions taken by this Congress and administration will reduce the number of people insured by about 15 million. And as a direct result of this administration's policies and priorities, the cost of living has become increasingly unaffordable. Moreover, the president has recklessly gotten us into another war in the Middle East, causing energy prices to skyrocket. And as those energy prices skyrocket, your budget would eliminate the Low-Income Home Energy Assistance Program, LIHEAP, which helps millions of families stay warm in the winter and cool in the summer, reducing the risk of health and safety problems arising from unsafe heating and cooling situations. Similarly, American families are struggling to find safe, affordable child care. In Trudeau's word that it is not possible for us to take care of daycare, the president's budget proposes flat funding both Head Start and the Child Care Development Block Grant, even though current funding levels serve only a small fraction of eligible children. And when adjusted for inflation, flat funding would likely result in fewer children actually served. In addition, the president's budget would completely eliminate the Preschool Development Grant, which helps states improve the quality and safety of child care programs and ensures all children can arrive at kindergarten ready to succeed. Last year, HHS illegally withheld funds from Head Start facilities nationwide, pushing many Head Start programs to the brink. And earlier this year, HHS froze over $10 billion in congressionally appropriated funds for 5 Democratic-led states, which also impacted child care development funds and the Temporary Assistance for Needy Families, TANF. These actions were not without victims. Many child care providers and grantees are already operating on shoestring budgets. And without federal support, child care centers may have to close. And when they do, the parents are left in the lurch without access to child care. In times like these, the social safety net programs provide struggling families a lifeline. Or if these programs have either been taken away or scaled back under your leadership. Cutting these programs doesn't make the cost of child care, food, or health go away. It only shifts the burden onto the households that can least afford them. Last thing, I want to address the growing concerns of Americans with disabilities who have been acutely impacted by your department's policies and priorities. Last year, you targeted the Administration for Community Living, an office that houses several key programs for people with disabilities as well as seniors. The loss of ACL would not merely be a bureaucratic shift. Its proposed elimination sent a clear message that the rights and safety of people with disabilities and older adults were no longer a priority for HHS. After more than 50 years of bipartisan progress towards independent living and equal opportunity, the proposed dismantling of ACL takes this country backwards. Last August, I released a report detailing how the administration has undermined programs such as Centers for Independent Living and Assisted Technology. Moreover, the Big Ugly Bill's deep cuts to Medicaid will inevitably reduce home and community-based services, the very support that allows people with disabilities to live independently. I'd like to ask unanimous consent to enter that report into the record.
Without objection. Objection and hearing none, it will be entered.
Thank you. Additionally, your proposed budget eliminated the chronic disease self-management education and fall prevention programs, effective programs that seniors across the country have come to rely on. When services are cut, families face impossible choices, people risk losing their independence, and so I ask you to reconsider your position and recommit to fully supporting people with disabilities and older Americans. So, Mr. Secretary, I want today's discussion to focus on how we can actually fulfill HHS's mission and your commitment as citizens, our commitment as citizens to care for one another. Regrettably, I fear that this budget proposal will not serve that goal. Thank you, and I yield back.
I thank the gentleman. Pursuant to Committee Rule 8C, all members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. 14 days after this hearing. And without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material noted during the hearing to be submitted for the official hearing record. I'll now turn to the introduction of today's witness, the Honorable Robert F. Kennedy, Jr., Secretary of the U.S. Department of Health and Human Services. Mr. Secretary, we are grateful to have you here today. Thank you so much. As you're aware, it's your responsibility to provide accurate information to the committee. Pursuant to committee rules, I would ask that you limit your oral presentation to a 5-minute summary of your written statement. And with that, Mr. Secretary, you're recognized for your testimony.
Thank you for that, Chairman Wahlberg and Ranking Member Scott, members of the committee. I appreciate you all coming. I know a lot of you had a late night. And Ranking Member Scott, thank you for taking time to talk to me here earlier this week. And thank you for the opportunity to be here to discuss the President's fiscal year 2027 budget request. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policy, captured agencies, and profit-driven systems caused it. Parents across the country demanded change, and we are delivering it. We are ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated the most favored nation drug prices with 16 of the largest pharmaceutical companies. So Americans no longer pay more than other people in wealthy countries for the exact same medications. We are bringing real transparency to healthcare pricing so patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table and reform prior authorization. We are cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued the new dietary guidelines that put real food, whole food, at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has also opened the door to partnerships with industry, trade associations, nonprofit, and advocacy organizations. More than 50 medical schools have committed to expand nutrition education from an average of just 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry is committed to phase out petroleum-based dyes by year end, and many have already eliminated them. We're also working with the 400 top tech companies to end information blocking, and they've all pledged to do so, and Americans are already seeing the benefits. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families and driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harm. We're eliminating outdated and misleading warning labels on hormone therapies used to treat women during menopause. We're strengthening oversight of organ procurement. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying that same focus and urgency to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years, to strengthen rural hospitals and ensure that Americans can access the care they need no matter where they live. Members of Congress on both sides of the aisle have made rural health a clear priority in their conversations with me because every state is feeling the strain of hospital closures, workforce shortages, and gaps in access. HHS announced more than $135 million investment this month alone to expand rural residency programs from a completely different program. Nutrition services. The data is clear. When physicians train in rural communities, they're far more likely to stay and serve there. The president's budget also puts these priorities into action. It invests in prevention because preventing disease costs less and delivers better outcomes than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word, but change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of failing the status quo, and institutions that put profit ahead of the American people. The resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity to implement and codify lasting generational reform in American healthcare for our country, for our children, and for the health of the American people. Together, we can make America healthy again. Thank you.
Thank you, Mr. Secretary. Under Committee Rule 9, we will now question Secretary Kennedy under the 5-minute rule, and I might make mention, Mr. Secretary, that this committee, while it's known for being passionate in its questioning and its debate, it's still so far this term has followed the example that we could have a second grade class turn in and watch our meetings and our hearings and our questionings, and the teacher wouldn't have to turn it off. And I think that will be the case today. But
That will be refreshing, Chairman.
it'll be firm and it'll be strong, but I trust it'll continue to be respectful. I'll now recognize myself for 5 minutes of questioning. There is a burning question in inquiring minds, as I understand it, to hear you answer the question as to whether you're responsible for the measles outbreak. So let me ask that question.
Thank you, Mr. Chairman. And I've been accused of that. The accusation is not science-based. The measles outbreak began in January 2025 before I took office. Now, almost 90% of the people affected are over 5 years old, so they made the decision not to their decision to not vaccinate predated my occupation of this seat. We've done better. The measles outbreak is not an American phenomenon. It is global. It's happening all over the world. And we've done better under my leadership than any country in the world in limiting it. Last year, we had approximately 2,200 cases. Mexico had more than 3 times that number, and they have 1/3 of our population. Canada had double that number, and they have 1/8 of our population. Europe had almost 10 times that number, and they only have double of our population. Many other countries have lost their elimination status. Canada lost it. Britain lost it. These are countries I haven't visited in years. Many European countries have lost it, Austria and others. I want to say something because 2 little girls died tragically in the Mennonite community in Texas. The Mennonites have not vaccinated since 1796. Oh, this has nothing to do with me. I went to the funeral of one of those little girls, and I spent a day with the family of the other. And both of them told me that when they took their children to the hospital, they were treated as pariahs. They were shamed. They were not given proper treatments. Both families believe their daughters, and their own doctors believe their daughters could have been saved if the hospital gave them proper treatment. The fact that they did not have a proper treatment to give them is regulatory practice by this agency. This agency has been so focused on a single intervention that it does not advise doctors about how to treat people who are actually sick. There's a lot of people in this country who, for religious reasons or other reasons, are not going to vaccinate. And I believe that we need to treat them with compassion and understanding and empathy and get them the treatments that they would get anywhere else in the world, except for this country.
Okay.
Thank you.
Thank you. As part of the Trump administration's effort to return education to the states and put power back into the hands of parents and families as well, HHS has signed a number of interagency agreements with the Department of Education to administer medical accreditation and early childhood education and care programs. Please say more about why it makes sense to run these programs out of HHS.
Well, some of these programs should have always been under HHS purview. It just makes more sense. They're health-related programs rather than particularly educated programs. And we have many parallel programs at HHS that can benefit from synergies from each other. The decision is also within the purview of the DOE Secretary, Linda McMahon. She has power to contract out these functions to other agencies, and it's a broad power, and she's operating under that power.
There have been troubling reports of states removing children from their parents' care when those parents decline to support their child's self-identification or identification as another sex. Do parents have the right to raise their children according to their sincerely held religious beliefs or moral convictions?
President Trump believes that they do, and during the Biden administration, HHS sent out letters to states to pass legislation to prohibit people who had certain religious beliefs from being able to foster children. This turns out to have been a very, very large pool of people. And as a result of that, the ratio between children, foster children, and parents has dropped to 2 to 1. Our objective by the end of my administration here and the Trump administration is to get us back to a 1-to-1 ratio. And we have sent out letters to all the states to end that policy.
Thank you. My time has expired. I now recognize the gentleman from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman. Mr. Secretary, After 14 months on the job, your long overdue appearance before this committee is particularly pertinent given the fact that your uncle, John F. Kennedy, served on this committee for his entire 6 years as a House member representing the 11th District of Massachusetts. As his National Archive bio states, as a House member, he advocated expanding health care for all. And as president in 1961, he supported passage of Medicare legislation, the King-Anderson bill, which was ultimately enacted in 1965 by his successor. That transformational federal law provided universal insurance for seniors at a time when only 50% could afford health insurance. And over time, it has vastly improved the health and life expectancy of our nation. Your other uncle, Senator Ted Kennedy, who I'm proud to say campaigned for me when I was first elected to Congress by a whopping margin of 83 votes, declared, quote, universal health care is the cause of my life, and was lead sponsor of the Affordable Care Act when it was introduced in 2009. He did not live to see its enactment, but we know now that the ACA successfully cut the uninsured rate in half by 2024 prior to your arrival at HHS. Clearly, universal health care is not the cause of your life. On your watch at HHS, we've seen a massive jump in the uninsured population. Since January 2025, 1.2 million have already lost coverage thanks to the Trump administration's refusal to extend the ACA enhanced tax credits, even though we passed a bipartisan bill in the House to do so. A couple of days ago, the Wall Street Journal reported that 1.2 million number is going to continue to grow because 14% of new enrollees this year didn't make their first payments for the new Trump premiums. As the Journal reported, this will add millions more to the ranks of the uninsured. Even worse, with the passage of the misnamed One Big Beautiful Bill, CBO reports another 10 million at least will lose their coverage as states are forced to implement the largest cut to Medicaid in American history. According to Gallup 2 weeks ago, the affordability of health coverage has now jumped to the top domestic policy concern facing Americans, which is pretty striking given the fact that the cost of housing, groceries, and gas to get to work has skyrocketed under this administration. But they're right to be concerned about the expense of trying to maintain insurance coverage, because they know when you lose health insurance, you miss routine checkups, preventive tests and scans for cancer and heart disease, and inpatient care if needed. Slashing health insurance affordability does not make America healthy nor more economically secure. At an Easter luncheon a couple of weeks ago, Mr. Trump stated that, quote, it's not possible for the federal government to pay for Medicare and Medicaid. It's up to the states to take responsibility for those programs. As the person in charge of CMS, and after 60 years of operation as a federal program, which, by the way, your father voted for in 1965 when he was a senator from the state of New York, do you support his position that states should take over control and operation of the Medicare program?
I believe that we should save Medicaid and Medicare. They're absolutely critical programs, and President Trump has pledged to do that and is doing everything in his power to do so. There are no cuts to Medicaid. You look at the CBO, the Congressional Budget Office report.
My question, excuse me, was: do you think the states should be vested with control of the Medicare program? That's the question, because that's exactly what he said. He's your boss. Is that your position?
President Trump's position is that we should preserve Medicare.
No, by sending it to the states, that's the death knell.
Are you saying Medicaid or Medicare?
Medicare. It's right there.
Yeah, President Trump's objective is to save Medicare, and we are taking...
Not by well, it will not save it by sending it to the states. That will destroy the program, and that's why it was designed the way it was 60 years ago.
I don't think there's a proposal to send it to the states.
Okay, let me ask you another question.
I don't know of that proposal, and the president has not told me about it.
Well,
the president's trying to save.
Well, for seniors and American families, they listen to what the president says, and they understand exactly what he's talking about, which is destroying the Medicare program. In your testimony, you talked about having insurance premiums.
You clearly don't want me to answer these questions.
Well, you actually didn't answer the question at all. You didn't talk about whether the state should be given the authority to run Medicare.
My answer has to begin with correcting a lot of the misstatements that you made in your introduction. I'm happy to do that.
Well, that's not a misstatement. That's a direct quote from your boss.
I'm telling you the president's policy is to save Medicare. That's what he's always
And giving
said.
it to the states will destroy Medicare. I yield back.
Gentleman yields, and I recognize the gentlelady from North Carolina, Ms. Virginia Fox.
Thank you very much, Mr. Chairman. Mr. Secretary, it's good to see you. We welcome you to the committee. I have to join the chairman, Chairman Wahlberg, in saying that the Department of Health and Human Services budget request is a breath of fresh air. Congratulations to you on presenting us with a budget that could reduce spending by $1.8 billion annually, saving taxpayer dollars at the federal level while still providing the programs and services that reach families who need them. Under the previous secretary, the department engaged in runaway spending. So I congratulate you on what you're doing. Secretary, this committee's held 2 hearings and marked up 8 bills related to the Child Care and Development Block Grant, or CCDBG program. Federal child care assistance is a critical support for low-income working parents seeking to access child care and remain in the workforce. Therefore, child care is not only a family issue, but an economic issue. HHS awards many different grants for states in the human services space. Can you explain the urgent need to protect programs like CCDBG from waste, fraud, and abuse, especially as they are administered at the state level?
I mean, we saw during the Biden administration, my predecessor actually instructed people in my department to end program integrity. So we had 80 people in my department when Secretary Becerra came in, were assigned to do program integrity for these programs, these state programs, and he fired all but 6 of them. So that stopped. And they specifically told people in my department, don't worry about fraud, worry about enrollments. They changed a policy to a policy of our payment policy, to a pay and chase policy, so that even claims that we knew to be fraudulent, we would pay and then later go back and try to claw back that money, which incidentally never happened. We have now changed those policies. We are investigating the fraud, and I'll give you one example. In Minnesota, for applied behavioral analytics, which is treatments for autism, kids with autism, we were expecting to pay $7 million a year for that program. We ended up paying almost $300 million. The difference is fraud. And we're seeing that now, that money was some of it was being sent to Al-Shabaab in Somalia. We have now impounded payments to Minnesota because they, for one quarter, about $350 million, because they've refused to give us receipts. And we've said, we're not gonna pay until you can show us the receipts.
Well, I'm proud to say that in North Carolina, our Republican legislature is doing everything it can to hold Democrat elected officials in the state to account for fraud and abuse in North Carolina on Medicaid and other programs. And so I'm very proud of them. I also want to say, Mr. Secretary, many of us have issues from our states and from our constituents that deal with HHS. And I hope you'll commit today to helping us get some of those issues solved, because many times they do save money for the taxpayers. So I will appreciate your making that commitment.
Congresswoman, I look forward to working with your staff.
Thank you. My last question, Mr. Secretary, is I have heard today that a new Danish study just came out finding no connection between Tylenol and autism. What is your reaction to that study?
The study is a garbage study. It should be retracted. The study took the medical records of 1 million Danish women, and it compared women who got Tylenol during pregnancy to people who did not. The problem is the way it determined whether they got Tylenol during pregnancy was by prescriptions. So only 2% of the people in the study got Tylenol during pregnancy, according to the endpoint. In fact, we know, because Tylenol is available by over the counter, Most of you have taken Tylenol. Very few of you have ever gotten a prescription. 50% of the women in Denmark, we know from other studies, actually took Tylenol during pregnancy. So the study was comparing women who took Tylenol during pregnancy to women who took Tylenol during pregnancy. It was a garbage in, garbage out study. The industry has the capacity to generate these studies all the time, and it's fraudulent. It should be retracted.
Thank you,
Gentlelady's
Mr. Chairman.
time
I
has
yield back.
expired. I now recognize the gentlelady from Oregon, Ms. Manamichi.
Thank you, Mr. Chairman. Mr. Secretary, the mission of the Department of Health and Human Services starts with these words: to enhance the health and well-being of all Americans. This is a yes or no question. Does all Americans include children?
Of course.
Well, I frequently talk with families who tell me they can't find childcare, and if they can find it, they can't afford it. In fact, the childcare crisis is costing families about $134 billion in lost earnings annually. And recently, as we've heard this morning, and I'll repeat, the president said there's no money for daycare because he needs more money to fight the war, which is costing about $2 billion a day. Your department's budget flat funds childcare, which won't help at all. Yet you did spend money on a bizarre vanity video with Kid Rock. So Secretary Kennedy, how does it enhance the health and well-being of children to spend HHS's limited resources and taxpayer money on a video of yourself drinking milk in a hot tub with Kid Rock? And how much did it cost to prepare and produce this video?
Congresswoman, I was asked to cut costs across my department because we have a $39 trillion debt.
I understand, Mr. Secretary. How much did it cost to produce this video?
I want to correct something that you said.
I'm asking how much did it cost to produce
I would have
this
no
video?
idea.
Okay, you don't have any idea. Well, I'll tell you
would have
that
no
that
idea.
money, whatever it cost, I consider waste, fraud, and abuse. And that's money that should have been invested in our nation's children and spent on something like healthcare and childcare that actually improve people's lives. You know, the
Actually,
return,
you know,
the
so
return,
many people have come up to me who saw that video and say, that inspired me to
Mr.
work
Secretary,
out. That's one of the things that we want to do in
the
this
return
department.
on investment that we get from early childhood education shows that for every dollar we spend, we get back somewhere between $4 and $16. Secretary Kennedy, about 20 years ago, the United States eliminated measles. So we thought. But now, because of your anti-science rhetoric, vaccination rates are down, in many places below the 95% threshold needed to maintain herd immunity. And I know you said that happened before you were secretary, but Mr. Secretary, you've been a long-time voice against vaccination for more than 20 years. Measles is highly contagious. It can make babies who may be too young to be vaccinated, so sick that they stop eating and drinking and may develop pneumonia or brain swelling. In my home state of Oregon, the Oregon Health Authority just recently warned about multiple new locations where people may have been exposed: a community college, a middle school, health clinics, grocery stores. This is unacceptable. So Secretary Kennedy, does exposing infants and children to measles enhance their health and well-being?
I've never been anti-vaccine. I've always said I'm not anti-vaccine. Right now, I just approved 3 weeks ago $500 million for research on a new cancer vaccine.
Okay, Mr. Secretary,
spending
you have
hundreds
been
of
a
millions of
long-time
dollars
voice against vaccination. You
No,
cannot
I haven't.
deny that.
No, I'm not anti-vax. I'm pro-science. What I've said is vaccines should be adequately safety tested so we know both the risks and the benefits. I'm funding a major study on developing a universal flu
Reclaiming my
vaccine
time,
at NIH.
Mr. Secretary, in fact, you have said in a congressional hearing that people should not be taking medical advice from you. The problem is that they are, and they believe what you say. So, Secretary Kennedy, I have another question. Does enhancing health include mental health?
Of course.
Good, I'm glad you agree, because recently masked armed ICE agents surrounded some high school students near their school. A Latino student from Oregon, a U.S. citizen, recently spoke about he and his friends feel scared at school, have trouble focusing, and feel dehumanized. And President Trump, as you likely know, repealed the guidance that keeps ICE out of sensitive locations like schools and healthcare centers. Now, children can't understand the complexities of the U.S. immigration system, but they are scared and they can feel anxiety. So, Secretary Kennedy, does it enhance the health and well-being of children to allow immigration enforcement in and around schools and at childcare centers? Does that help kids?
It was not enhancing our health and well-being of the American people to allow 20 million illegal aliens into this country. And President Trump, again, is left with a mess that he is having to...
Mr. Secretary,
that he is having to clean up.
in no legal or
mess that you
moral or
helped create.
ethical frame does it make sense to punish children. Young children's brains are highly influenced by
That
these
was the
stressors.
biggest humanitarian crisis in modern history, what you guys caused. Well, if you cared about children, we have now stopped
Secretary.
97% of the unaccompanied minors from coming across the border.
Mr. Secretary, supporting the
That
health
evinces a concern for children.
Mr.
What you were
Secretary,
doing did not.
I'm reclaiming my time. Supporting the health and well-being of our nation's children is the best investment we can make for the good of the country and the safety and health of American people, including children, and to truly make America healthy again. You should resign and allow someone with real qualifications to run this agency.
Gentlelady's time has expired. I now recognize the gentleman from Wisconsin, Mr. Grothman.
Yeah, I voted for President Trump for a lot of reasons, but one of the primary reasons was I thought he might give you this position. So I'm glad you're here.
Very grateful.
Yes. And on this mental health thing, I am, given where the mental health professionals have stood on this transgender treatment, I wonder how much we can trust that occupation to get anything right. So just, not everybody thinks we ought to give these mental health professionals more. But now we're going to switch to the questions. What effect have the poor guidelines from the old food pyramid, what effects have poor guidelines on the old food pyramid had on child health? And by the way, compared, yeah, Matt, go ahead.
Yeah, I mean, the food pyramid was, for 50 years, it was written by industry lobbyists and reflected the mercantile ambitions of those industries and not public health. It pushed Americans towards ultra-processed foods and highly refined carbohydrates that destroyed their metabolic system. 70% of the calories Americans eat typically right now are ultra-processed or highly refined carbohydrates, and it caused a metabolic crisis. Diabetes is an example. When I was a kid, the average pediatrician saw one case of juvenile or of type 2 diabetes over a 40 or 50-year career. Today, 38% of American teens are diabetic or pre-diabetic. It has made our country the sickest country in the world, the sickest with chronic disease in the history of the world. 77% of American children cannot qualify for military service. That should get a lot of people's attention.
Well, I'll tell you, there's a lot of money floating around here from the junk food lobbyists and the pharmaceutical industry, and I'm glad you're taking it on, and I'm sure you're going to get a lot of hostility from the other side of the aisle from your desire to do that. Touching on this sex change operations and all this hoo-ha, the professional medical societies, and particularly the mental health societies, have endorsed these sex change operations. To me, it means we just can't trust the medical societies. But why do you believe they did this? Why were the mental health professional people pushing sex change operations on 14-year-old kids? Why do you think?
Well, it was a multi-billion-dollar industry, and I think that the corruption follows the money. But you look at the science. There's now been 2 major meta-reviews been done. The CAS study in the UK, which the revelations in the CAS study stop Europeans from funding these. And then we did our own meta-review plus individual studies at NIH that showed the same thing, that the results to children, the outcomes in children are catastrophic in terms of depression, suicide, all kinds of illnesses. It's condemnation to a life of misery. And there is no scientific justification.
Common sense. I give you a follow-up here. What can we do to protect children in the future from the medical associations, and particularly the mental health medical associations, from harming our kids? How can we prevent them from doing that?
Well, we have taken steps to do that. We have ended all federal funding for those for puberty blockers and gender mutilation surgeries, and we have instructed hospitals and medical centers around the country that if they do host those kind of interventions, that they will lose all their Medicaid and Medicare funding.
Thank you. What scares me is the professionals who pushed this stuff in the past are still practicing. And that concerns me, because if they can't get this right, if they're pushing sex change operations on 14-year-old kids, I'm afraid they probably can't get anything right. Would you ever, under any circumstances, send one of your grandchildren to a medical professional who you knew, even if he stopped doing it, had at one time or other pushed this stuff?
I would not.
Yeah, I didn't think so. Now, a quick question, follow-up. We talked about nutrition, and a large segment of American society gets their money from food stamps or food share. Would you be in favor of some widespread restructuring this whole program, or maybe getting rid of the food stamp program and starting with a new program that was more healthy-based?
I support the food stamp program, and under Brooke Rollins' leadership at USDA, we are transforming it. We've already, with Brooke and I encouraging them, over half the states have now applied for SNAP waivers. They're no longer paying for sugar sodas, which were 10% of the SNAP budget. So we were giving poor kids, 63 million poor kids in this country, diabetes for free at federal expense, and treating them. 78% of them end up on Medicaid, and we're treating them afterwards. We were paying at both ends.
The gentleman's time has expired.
Half the states, almost all red states, although 2 blue states, have now applied for SNAP waivers. Soon we're going to have a definition of ultra-processed foods. We're going to encourage.
Gentleman's time has expired. I have to move on, and I recognize the gentleman from California, Mr. Tucano.
Thank you, Mr. Chairman. Mr. Secretary, you are the nation's top health official, and I want to talk to you today about the president's mental health. On April 5th at 8 o'clock in the morning of Easter Sunday, President Trump posted this statement on social media. Tuesday will be Power Plant Day and Bridge Day, all wrapped in one in Iran. There will be nothing like it. Open the fucking strait, you crazy bastards, or you'll be living in hell. Just watch. Praise be to Allah, President Donald J. Trump. An American president used the F word in a Sunday morning message that was seen by millions of people. Mr. Secretary, does this raise concerns for you about the president's mental health?
The president is a bargainer, and he knows how to make good deals.
Mr. Secretary, does this raise questions about the president's mental health to you?
Here's what I would say, that for 2 generations, every American president...
Mr. Secretary, you're being non-responsive. I'm reclaiming my time, Mr. Secretary. I gather the answer. It does not raise concerns for you. 2 days later, on April 7th, President Trump put out a statement that said, quote, "A whole civilization will die tonight, never to be brought back again. I don't want that to happen, but it probably will," end quote. Mr. Secretary, the Commander-in-Chief of the United States military is calling for the eradication of an entire civilization. And 5 days later, the president started posting on Truth Social at 9 p.m. at night, continuing until 5 a.m. the next morning, and included an unhinged attack on Pope Leo, claiming Pope Leo was weak on crime. And then, later that day, the next day, President Trump posted this image of himself as Jesus Christ. Mr. Secretary, people across the country and around the world were deeply offended by this blasphemous image. Millions of Americans are questioning this president's mental fitness, his emotional stability, and whether he can carry out the duties of his office. Do you share their concerns about his mental health?
I want to call your attention to the last line of that.
Mr. Secretary, my question was, do you share their concerns about his mental health?
I want to call your attention.
Mr. Secretary, you're not being responsive. Apparently not reclaiming my time, Mr. Secretary. Mr. Secretary, reclaiming my time. Mr. Chairman, direct the witness. It's my time, Mr. Secretary. You're not being responsive, and apparently you don't share their concerns. We are a nation at war, Mr. Secretary. We need a commander-in-chief that we know has full command of his mental faculties and is emotionally stable as he sends uniformed American men and women into harm's way. Millions of Americans are now wondering if this president is delusional and thinks he is Jesus Christ. Mr. Secretary, given everything that I've shown you today, will you insist that President Trump undergo an assessment of his mental fitness and his emotional stability?
Absolutely not.
Thank you, Mr. Secretary. Reclaiming my time absolutely not. I remind you that under the 25th Amendment, you have a duty to remove a president who is physically or mentally unable to discharge his responsibilities under the Constitution. It's your duty. You took an oath to the Constitution, not to President Trump. Mr. Secretary, should President Trump fail a mental fitness test or an evaluation about his mental stability or emotional stability, would you vote to invoke the 25th Amendment?
There hasn't been a president who's more
Mr. Secretary, my question is, would you vote to invoke the 25th Amendment? Mr. Secretary, reclaiming my time. It's my question, Mr. Secretary. Would you invoke the 24th Amendment if he were to fail an assessment of his mental stability or emotional stability?
As I said, President Trump is the most...
Apparently not, Mr. Secretary. Apparently not. Mr. Secretary, we can all see that this president is mentally unstable, emotionally unstable, and is unfit to lead this country. You, as the nation's top health official, have a particular role here. And you are choosing your loyalty to Donald Trump over your loyalty to the Constitution and keeping the faith with the American people. Thank you, Mr. Chairman. I yield back.
Well, you need the fundraising video.
Mr. Chairman,
Thank you.
Questions.
The gentleman's time has expired and been yielded, and I can ask the second grade classes to turn in again at this point. I'd hesitate to say something about the 25th Amendment with the last president. There was no concern there from the other side, but I won't say that. So now I recognize the gentleman from Georgia, Mr. Allen, for his 5 minutes.
Thank you, Chair Walberg, for holding this important hearing, and I thank Secretary Kennedy for testifying. Sir, I'll yield time to you. Would you like to answer the gentleman's question?
Well, I don't really care to, but because I'm not here to discuss foreign policy, but every Democrat in this chamber has promised for generations that we weren't going to let Iran get a nuclear weapon. It kept kicked down the road. President Trump is cleaning up messes that other people made, and he's doing it in a way he's the best business bargainer that we've ever had in the presidency. He knows how to make deals. He's made the best deals for this country through tariffs, all the things he's engaged in. He's a genius at it. Let him do his work. Let him be president. Give him your support, and let's support this country and our troops and try to move forward as a nation. He's trying to fix the problems that you made.
Thank you, Mr. Secretary. For years, getting back to the subject we're talking about here today, is health care, and we got a mess there too, created by obviously the Affordable Care Act, and we're spending $5 trillion on health care, and we get the worst outcomes. I mean, that's what we should be concerned about here today. But for years, pharmacy benefit managers have benefited from opaque pricing tactics while health care costs continue to soar. My legislation, the PBM Kickback Prohibition Act, would prohibit PBMs from paying consultant and brokers who give trusted advice to employers and group health plan fiduciaries from taking compensation for steering businesses to PBMs. What steps can HHS take to curb PBM's abusive practices, and how might Congress be able to assist in this effort?
Well, it's one of the, I would say, perverse features of the healthcare system that PBMs who had nothing are getting 40% of the profits from drugs, and they're driving up costs everywhere. President Trump has us laser focused on fixing the problem, and I want to thank Congress for passing the recent bill that allows us to now go and negotiate with the PBMs. We were already doing that. I want to commend Cigna and David Cordani for actually developing a model that is much more rational and that gets rid of the hidden kickbacks, that delinks the cost of the list price of medicines from the compensations of the PBMs. The PBM's compensation was increased by getting you to buy the most expensive. There's supposed to be a neutral arbiter on your side. They made money if you bought the most expensive form of that medication. So they were steering Americans always toward the most expensive one, and that's one of the things that drove up healthcare.
Well, we're losing pharmacies
Right.
every day in rural America.
And we're getting
this stuff's
vertical
gotta stop.
integration that is destroying our healthcare system.
And then let's talk about healthcare affordability. You know, affordability is a big subject today, and obviously, we spend twice what any other nation spends on healthcare with worse outcomes. You know, I'm talking about American workers and their families in ERISA specifically, which is where we cover most of the lives. What do you believe is the underlying causes of high health care costs? And would you please discuss how much control employers who provide health benefits for their workers have over these costs?
Well, the biggest driver of healthcare costs is the chronic disease epidemic. So when my uncle was president, we spent zero on chronic disease in this country, zero. Today, we're spending 48% out of every dollar paid, if you include Social Security, health expenditures in the military. 48 cents out of every dollar the taxpayer gives to the federal government goes to healthcare, and 90% of that is chronic disease. The only way that we can solve this problem is through chronic disease. Another driver is high drug costs. We were paying 2, 3, 5, 10, 15 times for the exact same drug made in a plant in New Jersey. And in London, for example, Ozempic in this country, the list price when I came in was $1,300. In London, you could get it in any pharmacy for $88. And that was the rule. We are now fixed MFN. So we're going to be paying the lowest cost in the world. Another driver is the lack of transparency. There's no market. If you go buy an automobile and the guy who's selling it to you said, I'm not going to tell you the price till after you buy it. Right. You'd think he was crazy.
I'm sorry, I'm out of time, but I would like
fixing that too.
Yeah, I'd like to meet with you on some solutions that we're talking about, particularly to privatize ERISA and give it a
Gentleman's time has expired, and I'm sure the meeting can take place. Now I recognize the gentlelady from North Carolina, Ms. Adams.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being here. I have a yes or no question. Do you agree that there's a connection between nutrition and health?
Of course.
Thank you. So nutrition and the importance of healthy foods seem to be a core part of the MAHA movement. Is that correct?
Of course.
Okay, like you, I believe that you can't be healthy if you're hungry. But as Secretary of Health and Human Services, do you, in your capacity, advise the President on nutrition issues as they relate to health?
You mean his personal health?
On health issues, any of it?
Oh, yeah.
Okay, thank you. Well, as I'm sure you know, many studies show that childhood is a critical time for proper nutrition. So a person's diet in childhood has a massive impact on their lifelong health and chronic disease risks. In February, you visited an elementary school where you had the opportunity to observe their scratch cooking practices and discuss the importance of serving healthy and fresh foods with school administrators and food service staff. So can you tell me why then did the President's budget include major cuts to programs for child nutrition, like the $5 million from the Farm to School program, eliminating school lunch equipment grants, and reducing the benefits that mothers and young children receive for fresh fruits and vegetables under the WIC program?
We are absolutely committed to child health and good nutrition. We just put, we've preserved Head Start from any of the cuts, and we just put $62 million into Head Start to make sure that the 660,000 children who are in Head Start can have
All right,
good,
let me
wholesome
reclaim my
foods.
time. I have some other questions. So, did the president discuss these proposed cuts with you?
Did the president? No.
Yes. Okay. Well, cuts to the program that help ensure access to healthy and local foods would be a betrayal, I believe, of the MAHA agenda, which is your agenda.
We are expanding.
So, excuse me, sir, I'm claiming my time here. Do you agree with these cuts being included in the president's budget?
We are expanding access.
Can you give me a yes or no? Do you agree with the cuts being proposed?
We are
in the budget?
expanding
All right, I'm
access.
reclaiming my time. Do you agree or do you not?
We are
Will you say yes
expanding.
or no? Okay. So can I count on you to urge the president to reconsider these cuts and instead invest in school meals?
He is.
Can we count on you? Is that a yes or no? Can you give me a yes or no? Can I count on you to
Providing good nutrition to children? Absolutely.
All right. So, well, listen, it seems like, and I'm glad you said that, but it seems like a betrayal of the people who have been promised by you as secretary to use your position to make food healthier. So thank you for clarifying that for the American people. Now, let me ask you about a survey of school food service directors who found that 79% of respondents expressed an extreme need for an increase in funding in order to expand scratch cooking and reduce the use of ultra-processed foods. So that same survey found that there's a serious need for additional staff, additional equipment, culinary training, and infrastructure. So, sir, are you aware of the barriers such as food cost inflation and lack of kitchen equipment that schools face in serving healthy meals to children across the country?
I'm absolutely aware of it.
Okay, so that's good to hear. But the budget,
And we are doing
the
something
budget
about it.
fails. Excuse me, sir. I'm claiming my time here. That's good to hear. Because the budget fails to provide any investments. And in fact, it does the opposite. So
That is not true.
what should I tell?
True.
I'm reclaiming my time. So what should I tell food service directors in my district who want to make the transition to less ultra-processed and prepackaged foods, but can barely cover the costs of these expenses? What should I tell them?
You might start by telling them the truth.
All right, well, I'm not getting that from you, but I suggest that you take the time to meet with food service directors across this country for a better understanding of the financial pressures on school meals programs. Many programs in our country are just not well funded enough. They're not, and you keep supporting the cuts in these budgets. They're not well funded enough to prepare meals and serve less ultra-processed and prepackaged food, all of which are alleged goals outlined in your MAGA report, Make America Healthy Again. You're not doing it, Mr. Secretary. Mr. Chairman, I yield back.
Gentlelady's time has
briefly
expired.
to
I
yield back.
I recognize the gentleman from Kentucky, Mr. Comer.
Thank you, Mr. Chairman, and Mr. Secretary, thank you so much for being here today. I want to bring to your attention a program very important to Kentuckians. The Community Services Block Grant, or CSBG program. Community action agencies throughout Kentucky leverage a lean budget of federal CSBG funding and private resources to help individuals and families set out on a path to financial independence and self-sustainability. The community action agencies in my congressional district in Kentucky have shared with me concerns about the delivery of CSBG funding administered by HHS being delayed. Thankfully, Kentucky Community Action has a well-managed budget and has funding in reserves to last them for several more weeks. Unfortunately, they estimate that funding will begin to run out in early May. Is there an estimate of when CSBG funding for the remainder of Q2 and Q3 will be released?
We are trying to get it out the door, Congressman. We are in the we're in the interagency process right now.
Right. Thank you.
Can I take a minute of your time just to reply to the previous?
Yes, sir.
What I would say to the Congresswoman is if you want just a soundbite that you can come in here, you can get that, and you did it. But if you actually want to solve the problem, call me, because we're aligned on the issue of getting good food to children, and we think that we're doing a good job of it. We could do a better job, but come and tell us how we can do a better job, and that would be something we could all profit from.
Thank you, Mr. Secretary. I love what you say about the sound bites. This is not the committee I chair. The committee I chair is Oversight Committee, and the Democrats live and breathe for sound bites. They have competitions to get on MSNBC and CNN during committee hearings, unfortunately.
I can't wait to comment.
Yeah. Well, again, talking about the work in my Oversight Committee, we've led an investigation of the pharmacy benefit managers. We still have a long way to go to prevent PBM manipulation of patient access to effective and affordable medicines. I was glad to see the Lower Cost, More Transparency Act signed into law by President Trump. As you know, the PBM transparency and disclosure requirements included in that law will give patients and plan sponsors a more accurate picture of how little-known companies have distorted and taken advantage of our nation's healthcare system. My question, Mr. Secretary, do you consider vertical integration by the PBMs and their related companies a safety issue?
I absolutely do. And there's 4 companies that basically control the whole industry, and that's not good by any economic model. Mm-hmm. It destroys competition. It raises prices. It lowers the quality of care.
Absolutely. Absolutely. There are 3 FDA-approved drugs for a common form of leukemia. Doctors must prescribe the most effective one based on each patient's individual health profile, including heart conditions or past responses to medication. These 3 leukemia drugs are not interchangeable, but some insurance plans are making patients fail on day 1 before they can access the preferred course of treatment prescribed by their doctor. So on March 19th, I sent a letter to Dr. Oz expressing these concerns. However, I continue to hear stories about how insurance companies and their PBMs override physician recommendations and block patients from getting the drugs they desperately need. Is there a reason patients should have to fail first on another medication? And what is HHS doing to prevent insurers and their PBMs from acquiring these types of unnecessary and often harmful outcomes?
Well, I convene the insurance companies, the biggest ones that represent 80% of American lives, 3 months into my office, and I got them all to agree to end prior authorization in 87% or 80% of the procedures and conditions and prescriptions by 2027. So I think we may see an improvement, but as you know, it is a rapacious industry, and they have people who don't have medical degrees making decisions that are life and death for patients. After the doctor has said, you need this drug, some bean counter in the insurance company is telling them, I'm not going to let you have it. It's not a good system, and we have to end it.
And I'll conclude by saying this, Mr. Chairman and Mr. Secretary. I think we don't agree on a lot in here on a bipartisan basis, but I think everyone agrees that the healthcare system in America is a disaster. We blame that on Obamacare. Everyone wants to improve the healthcare system. We all believe two things, that the health insurers are taking advantage of patients. The health insurers are impossible to deal with by the providers, and the PBMs have to be reined in. So thank you for your great work, Mr.
Gentleman's
Secretary.
time has expired. I now recognize the gentleman from New Jersey, Mr. Norcross.
Thank you, Chairman, and I'd like to thank the witness for being here today. And hopefully in the next 5 minutes we can have a conversation that is unfortunately near and dear to so many people in the United States, certainly your family and my family, and that is the mental health and the disease of addiction. And the budget that is proposed speaks of the values of that organization. So in particular, I want to talk about the mental health parity. We've seen devastation, the impact that addiction has on families. We know that all so well. We've been to those funerals. This is an issue that I hope that we can have an area of some common ground. I'm not looking for a soundbite. I'm looking for answers, and something that I thought we had worked long and hard that we aligned. So the action by the department under your leadership suggests that the Trump administrations are retreating from the important issue and listening more to the insurance companies. Because as you know, if we go back 20 years, mental health was something that barely was ever talked about.
Can you just clarify the insurance companies on what aspect?
So parity, that if you...
Oh, for parity, okay.
Yeah, spend it physically, you have to spend the money, and this is where much of the addiction and mental health comes in. So looking at the facts, under your predecessor, the Department of Labor, Treasury, and your department had landmark regulations strengthening the oversight of the health plan and the insurers. And critically important, these are the toughest federal parity rules ever applied to insurance companies. Last year, the department announced that you would no longer enforce this regulation. Since then, the administration has refused to stand up to defend the regulation in a lawsuit by the trade association. To me, this is an indication of a retreat by the departments to go after, to make sure that mental health addiction treatment is available to anybody in the healthcare who has health insurance. And really surprised to see that this happened. Trump's bipartisan recommendation coming out of 2017 Opioid Commission, led by Chris Christie and former Representative Patrick Kennedy, amongst others, to increase the federal government's authority to enforce parity, going to the insurance companies to say you have to treat mental health, addiction services the same way you would treat diabetes or any other health condition. Why have the department that you have made this change, not going after the insurance companies so people can get the treatment they need?
First of all, I want to thank you for raising the issue and raising it in such a civil way. And I would, offline, I would love to talk to you more about this. We have a major, for me, it's a personal focus, but within my department, we have major new programs to address opioid addiction, other forms of addiction that I'd like to talk to you about. My cousin authored that bill, Patrick Kennedy. He is an advisor now to the department and is helping us on these policies. Unfortunately, we lost the lawsuit, and we are now developing a new rule. So that's where we are. I'm happy to go into details or have my staff meet with your staff, and I invite you to call me at any time.
We will. One of the major issues that we face going forward is that the rules in place that the insurance companies must do this, but if they are found to be in violation, there is no penalty. It's like speeding without getting tickets. It's a real problem. And just for the last few minutes, there's a major cut proposed in SAMHSA, that's substance abuse and mental health, literally almost a 40% cut. You know that. I know that is a backbone for so much that goes on. I encourage you to restore that money so this disease of addiction, mental health, that people can get their help. With that, I yield back.
I thank the gentleman. Pursuant to the previous order, the chair declares a committee in recess subject to the call of the chair. We'll plan to reconvene promptly in 5 minutes. Thank you. The committee now stands in recess. committee has finished the recess, and we will continue on with questioning. I now recognize the gentleman from Utah, Mr. Owens.
Thank you, Mr. Chairman. First of all, Mr. Secretary, thank you so much. We watched for decades as Americans have gotten sicker and sicker, and our country and individuals going into this financial ditch. I'm thankful that we're finally righting the ship, so keep up the good work and innovation. Early this year, we saw how the Child Care and Development Block Grant funding was defrauded in Minnesota to enrich bad actors taking advantage of a broken system there. In fact, the HHS audit report finalized last year made several recommendations for Minnesota to improve their anti-fraud measures. To your knowledge, did Minnesota work to implement those recommendations before the news broke, widespread fraud there? Yeah.
Microphone, please.
Congressman, let me just say, take a moment to say how delighted I am to see you and say a word about the Oakland Raiders, which is your former team. During the 1968 campaign, my father's bodyguard for a lot of that campaign were 4 members of the fearsome foursome of the championship Oakland Raiders team: Rosie Greer, Merlin Olsen, Deacon Jones, and Lamar Lundy. And the night that my father was killed, Rosie Greer was the first person to grab Sirhan. So my family has always had a very, very